Just when you thought the questions couldn't get any better, we have a photo. Check it out. What is that? It's a target cell. Now let's go. 34-year-old woman, routine follow-up. What have we got? Bullseye-like appearance, central staining. Let's just get to the question. We're pros. Which mechanism best explains the formation of these blood cells? Okay, so target cells. What's going on? Red blood cells, target cells, have a central dark area. All right. Well, let's just see here. The central dark area, that's the concentrated hemoglobin. The surrounding pale zone, that's less hemoglobin. And the peripheral dark ring, that's the excess membrane folds. So these form when the red blood cells have increased surface area relative to their volume. It occurs in thalassemias, iron deficiencies, and where you have like decreased volume, and increased membrane, which is like post splenectomy, obstructive liver disease, so why does this happen? Why does splenectomy lead to target cells? Well, splenectomy is where you remove excess membrane from aging or abnormal red blood cells in a process known as splenic conditioning. So the red pulp macrophages prune the red blood cells by removing extra surface protein. And without the spleen, this pruning stops. And the red blood cells, what happens? They get too much membrane. Why? Because they can't be pruned. And they fold in on themselves, making a target appearance. So over time, the hepatic macrophages may take over some of this role, but the target cells may decrease, but not disappear ever. And so this patient is going to have target cells due to excess membrane, which is caused by the loss of splenic pruning after, what does he get? A splenectomy. Okay? Does that make sense? A splenectomy is the surgical operation where you remove the spleen, right? Okay. So the loss of the splenic membrane pruning function is going to be our correct answer. A, inadequate DNA degradation. Okay, so that leads to Hal Joule bodies. Those are nuclear remnants that are seen in asplenia. And increased cholesterol to phospholipid ratio. So that can also cause target cells, but is more typical for obstructive liver disease. Decreased cytoplasmic hemoglobin ratio. That's common in thalassemia or iron deficiency, but this patient has normal hemoglobin and no anemia. So, no, not quite. D, decreased erythrocyte surface to volume ratio. Ooh, that would cause spherocytes, not target cells. Spherocytes are seen in hereditary spherocytosis and other autoimmune hemolytic anemias. Denatured hemoglobin aggregates. What about these denatured hemoglobin aggregates? Those would cause the Heinz bodies. Those are seen in G6PD deficiency, not the target cells. So surface to area goes up, causes a liver disease, thalassemia, asplenia, and the mechanism is excess membrane folding due to a lack of the membrane pruning by the spleen. So hopefully this is helpful, and like and subscribe if you guys like this content. The only other concept I think is worth discussing on this particular topic would be asplenia, like the difference of the formation and causes of target cells, specifically the membrane cholesterol to phospholipid ratio and decreased cytoplasmic hemoglobin concentration in asplenia, like the loss of a spleen. So the codocytes, the target cells, another word for them is codocytes. They've got the bullseye, central dark, pale halo, dark outer ring. And the three main mechanisms that cause them would be one, obstructive liver disease. That would cause the increased membrane to cholesterol to phospholipid ratio. And then two, thalassemia iron deficiency. That causes the decreased hemoglobin concentration in the cytoplasm. And then the asplenia and post-splenectomy, that causes the lack of the pruning. Right? So in a splenectomy, in asplenia or post-splenectomy, the problem is not from the liver or the hemoglobin. It's from the failure to remove the red blood cell membrane that builds up with age. So the red blood cells keep circulating with their floppy extra membrane, and then the target cells are gonna form. And so the mechanism is failure of the splenic membrane pruning, too much of the surface and target cells, right? If a patient has no spleen or had a splenectomy, then you get the loss of that pruning, and then liver disease, like high bilirubin and cholestasis, and will increase the cholesterol to phospholipid ratio. And so basically target cells, too much membrane. That's pretty much all you need to know. And that should do it. We'll see you in the next one.